So today we are going to do a procedure which is called microneedling. So skin pen, this is the skin pen. It's the only US FDA approved medical device for microneedling. So it looks basically like a pen only. So how do we adjust the markings as per the condition that we have to treat? So I'll tell you in detail how to fix, first of all, the derma needle on the DERMAPEN, right? So you can see this is the device. It comes with 2 batteries, right? So you can either plug it directly to the electrical point and do the procedure, or you can also use the batteries, right? So this is the skin pen. So if you see closely, right? So if you see closely, there are markings. They range from 0 all the way to 2.5. So these markings indicate the depth of the needles. So this is how we use it. So suppose you can either use a battery, fix it here, and then you use it straight away. The second way to use it is you fix this and then you connect it like this, and then you can fix with the device, right? Since I'll not be using the electrical point today, it's a bit far away. I'll just show you how to use the battery. Yeah, so this is how it goes. You fix it, and then you have to use the derma needles. They come in packets like this, right? So you open it, you open from here. This is the end which fixes in it. Right? So this is how you fix it. Now it's all set. So you can see there are tiny needles in this. So these DERMAPEN needles, they come in different sets depending upon a pair of 12 needles or 36 needles. So it depends which you're using. Which needle you're going to use depends on the area that you're treating. So today I'll be treating acne scars in one of my patients. So I'm using this needle. So if you see closely, these are the micro needles. So from here you adjust the depth of the needle. Now how much depth has to be adjusted depends upon the lesion or the problem that you are treating. So I'm going to adjust it to, so from here you adjust, right? So I'm going to adjust to 0.5. That means the needles are going to penetrate 0.5 millimeter into the skin, right? So here is the button. From here you press it and then you switch it on, and you can see the needles vibrating, right? You can also adjust the speed of the needles, like after how much fraction of a second do you want the needles to penetrate into the skin and create micro injuries. So you can adjust the speed from here, you can adjust the depth from here, you can switch it on and off from here. So this is the needle. So once it's done, you have to dispose of this needle, and for every patient you need a new needle, and you have to dispose it off in the correct manner, right? So you close this lid. Now this is how it's done. So microneedling, how it works is that the needles, these needles, they create micro injuries into the skin, and it stimulates the growth of new collagen and elastin. And it is used, this procedure is done for a lot of different skin concerns like stretch marks, acne scars, or any type of atrophic scars or hypertrophic scars. You can also do it for pigmentation and for fine lines, for skin tightening. And it can be used standalone. Only the microneedling gives very good results. You can also mix and match it with different, you can either use it with serums. Here we use the special serums which help along with the microneedling. They work synergistically to give better results. You can also use different type of serums are available in packs. So once the microneedling is done, you can use these sheets. They come in various skin packs. So you can use these sheets as well. So after microneedling, you can just put the serum and put the sheet over it so that the serum penetrates deeper. So there are different ways in which you can mix and match your skin treatments to give the best and desirable results to your patients. So now we'll go to our patient, right? And I'll show you how the microneedling process is done. So today we have a very young patient with us. So we are going to perform microneedling using the skin pen today. So she had basically the concern of open pores, as you can see on both sides of the cheek, and there's slight pigmentation around the chin area, and there is little bit of uneven skin tone all around. So before we start the procedure, so I'm going to tell you how to adjust the length and how to do and plan your treatment, right? So basically, so this is a skin pen, and I showed you just now that it has markings from 0 to almost 2.5, right? 3 mm. Okay. So when we start, so you decide your treatment depth, and what products you are going to use would depend upon the condition. Now on the forehead and chin area, you see it is slightly more pigmented, right? Second is that this area, it has very little fat, so it is all bones. So we will not go too deep. So on this area, on the nose area, the delicate area around the lip and the chin area, I'm going to adjust the depth to only 0.5 millimeter. I will not go beyond that, right? So on the cheeks, since she has a lot of open pores and I want to address and go till the dermis, like, right, a bit deeper. So I'm going to adjust it to almost 1.5 to 2 mm, right? So this is about the depth. Now, DERMAPEN, you can either, so you can do the treatment by two methods. One is the stamping method, where you just stamp like this, right? And other is where you move your DERMAPEN across, okay? So at places where you just want to achieve rejuvenation and you're not targeting to go deep down to the dermis, you just do it with the sliding technique, okay? On the cheek, this patient has open pores, but if there is a patient of acne scars also, you do with the stomping method, where you go and you press, right? So this is how. So I have adjusted the depth to 1.5 millimeter, and from here you switch it on and you do it with the stomping method. You put, press, move, put, press. So as you can see, the patient is comfortable since we had anesthetized the skin earlier. I usually use amla. It has wonderful results. So I have used 5% amla on this patient. So when you start feeling little erythema and pinpoint bleeding points, that is the point when you stop. On the forehead, you're just going to do like this. Here also, and on the lips, the nose area. She doesn't have any problem on the nose, so I'm not going to touch the nose area. So this is how the procedure is done. Now post procedure, what products you can use also depends on the skin concern. Like for the pigmentation here, I'm going to use the vitamin C serum, right? And for the open pores, I'm going to use the hyaluronic acid serum. or the retinol serum. So these are the two options, right? And so once you put the serums, you massage the serum into the skin. And this is the time, when you have created micro channels and whatever you want to apply on the face, this is the best time to do it, since it is going to penetrate deep into the skin and give you the desired results. So was it painful?
No, not at all.
Okay, you were comfortable.
Yeah.
Okay. So once the procedure is done, we just apply the serum and then we can top it up with a little sunscreen. I usually use the Everyday Elegance sunscreen. I have found over my experience that it gives wonderful coverage and sun protection, and the patient is all ready to go. So a few precautions before you leave the treatment room is that you might feel there is some redness which is going to remain for 6 to 7 hours or maximum till tomorrow morning. So you don't have to apply anything on the face till tomorrow morning. If you feel slight burning or any irritation, most probably, are you feeling any burning right now?
No, not right now.
Okay, so if you feel any burning, you can just do cold sponging, that's all. And this sitting, one sitting would give you some results, and the results would be visible after 4 weeks. And you have to come for 3 to 4 sessions at a gap of 1 month, right? So today is 31st August. So your next sitting would be either on 30th September or on 1st October, right? So we'll check the calendar and see what suits you best. Just make sure that you come for your regular sittings at a gap of 1 month, and 3 to 4 sittings would be sufficient. And then to maintain the desired result, the post-care after the treatment is very important, and you need to emphasize it to the patient, right? So I'll give you a sunscreen that you should be applying daily in the morning. I'll give you a serum that you have to apply morning and night, right? 2 times a day. And plus, I'm going to give you a cleanser, right? So this is an Everyday Elegance face wash. It's very good for the pigmentation, right? So it's a glutathione face wash. So you can use it twice a day. So, right, whatever treatment you've done today, right? So to maintain those results and to get excellent results, the importance of using a proper skincare regime post the treatment is very, very important. So please follow that.
Okay, thank you.
Okay, so it was lovely having you and doing your treatment, and I wish and hope that we are going to meet again on maybe 30th or 1st, exactly after 1 month. We will also send you a reminder so that you don't forget to come on time for the sitting. Thank you.
Okay, thank you.